Disturb me.
Good afternoon, dear listener. How are you doing today? You're welcome to a fresh edition of Outline on OGBC 90.5 FM. It is time to talk about your well-being on radio, and the program is Outline here in Abeokuta, Ogun State. I am Bolaji Eze. On Outline today, we shall be paying special attention on the importance of integrated supplementary immunization. What can we refer to as integrated supplementary immunization? Why and how is integrated supplementary immunization important? How effective is it? This and many other questions are what we shall be providing answers to on today's edition of Outline. You're welcome to the program. Of course, here with me I have in the studio Dr. Adekunle Solarin, who's the Director of Disease Control Immunization, Ogun State Primary Healthcare Development Board. Thank you so much for coming, sir.
Good evening, Anchor, and good evening, listeners at home.
All right, thank you so much. You're welcome, sir.
It's a pleasure having me here.
Now, going straight to business, we've always been hearing about immunization here and there, but now, what is integrated supplementary immunization? What's it all about?
Thank you. Immunization is basically to boost immunity of children, particularly, and adults when, for instances, when they are given immunization. Supplemental in the sense that we're using that opportunity to improve on what we have done.
Okay.
Some of these children may have been immunized back in weeks, years back, but it's an opportunity to boost whatever we've done. And that is basically where we're using supplemental. And integrated in the sense that we're going out with 2 or more vaccination. We're using the same opportunity, the same time, the same resources to administer to those children more than one vaccination at the same time. That's basically why we say it's integrated, because using more than one antigen.
Okay.
And we're boosting the 16 immunity using immunization.
All right. Now, talking about ISI, which is integrated supplementary immunization, you talked about it's not just something coming out fresh. It's like a backup. Now, why and
Changer in survivor, it's immunization. I'm sure before now we have children bearing kukumo, abiku, but since we began introduction of immunization, that has changed because it gives a lot of children opportunity to survive. So over time, we realized that as new diseases emerges, so also scientists also come up with vaccines which we give and say immunization. So what we do now is for some reasons, some children were not immunized.
Okay.
And for some reasons, maybe distance hard to reach, parents could not bring their children to ward. So we now go out periodically to host those parents who have brought their children to facility, and those that have missed an opportunity is also a catch-up opportunity for them. And that's why we say we are supplementing for those children we've immunized. And for those who miss the opportunity, it's a catch-up opportunity for them.
Now, for those who are not able